Many mature individuals swallow a small blood pressure tablet every single morning without truly understanding how that specific chemical agent interacts with their delicate cardiovascular systems on a daily basis. Swallowing a daily pill like amlodipine or lisinopril without knowing its mechanism can transform a standard medical routine into a silent hazard when certain ordinary internal bodily conditions shift unexpectedly. Most responsible individuals manage their personal finances with precision, but remain completely silent when asked to explain how their prescribed hypertension medication alters their internal organ functions. These essential capsules are not simple dietary supplements or harmless daily multivitamins, but are highly potent pharmaceutical compounds that actively modify the behavior of your heart and blood vessels. Millions of older adults take these powerful prescriptions completely on autopilot every day without possessing a clear understanding of critical warning signs that require urgent medical attention and care. A single routine prescription can quietly work against your well-being if you remain unaware of how it alters your physiology or when an apparently minor bodily change is actually a major warning signal. Consider the instructive scenario of an organized individual who assumed a new hypertension pill was just another identical remedy, only to suffer from severe lower limb swelling that ruined his quality of life. This dedicated person spent an entire year experiencing extreme discomfort and terrifying anxiety because nobody had ever explained the fundamental differences between major classes of cardiovascular drugs. Believing that all blood pressure medications behave in the exact same manner can cause individuals to endure severe adverse effects silently or mistakenly attribute serious symptoms to natural aging processes. When you grasp the unique, distinct patterns of these common pharmaceutical categories, you can stop interpreting every single physical symptom through a single distorted lens and protect your daily health. An organized approach to understanding your medication prevents unnecessary panic and ensures that you can safely differentiate between a minor, temporary nuisance and a true, life-threatening medical emergency. Seniors who educate themselves about their specific therapeutic regimens experience significantly less anxiety and become far more active participants in their long-term clinical care and wellness journeys. Amlodipine belongs to a class known as calcium channel blockers, which achieve their primary therapeutic goal by relaxing the smooth muscular walls of your arteries so blood flows with reduced resistance. While this medication relaxes the arterial vessels effectively, it does not exert the same impact on the veins, which are responsible for returning deoxygenated blood from your lower extremities to the heart. This functional imbalance causes an accumulation of fluid pressure within the tiny blood vessels near your ankles, which eventually forces watery liquid out into the surrounding soft subcutaneous tissues. The visible consequence of this precise physical process is puffy lower legs, deep, lingering marks from your socks, shoes that no longer fit comfortably, and a heavy sensation that worsens by late afternoon. This specific swelling is not a direct result of excessive dietary salt intake, nor does it indicate that your kidneys are failing or that you are entering the dangerous initial stages of congestive heart failure. The primary hazard arises when frightened individuals independently decide to discontinue their medication without informing their physician, which causes blood pressure levels to climb back to dangerous heights. Other misinformed people attempt to resolve the visible puffiness by severely restricting their daily fluid intake, which represents a dangerous strategy that introduces serious risks of severe dehydration. The correct course of action is having an open, detailed conversation with your healthcare provider regarding potential dosage adjustments, alternative choices, or practical strategies to manage the fluid. Elevating your lower extremities periodically throughout the day or altering the precise timing of your daily dose can frequently mitigate this common physiological response without compromising safety. Lisinopril operates as an effective inhibitor of the angiotensin-converting enzyme, which prevents the production of a specific natural chemical substance that normally causes blood vessels to constrict. A highly prevalent side effect associated with this particular class of medication is a persistent, dry, scratchy cough that originates from a tickle at the back of the throat and fails to yield to lozenges. This uncomfortable respiratory issue is entirely non-productive, meaning it does not bring up any mucus, and it frequently intensifies when an individual attempts to lie down to rest flat in bed at night. What makes this dry cough exceptionally difficult to identify is that it often delays its appearance for several months after an individual has successfully initiated their daily therapeutic regimen. Because the symptom manifests long after starting the drug, many patients mistakenly attribute the irritation to seasonal pollen allergies, environmental dust particles, a lingering cold, or acid reflux. Consider a dedicated woman who endured an irritating cough for 10 painful months, spending excessive money on air purifiers and antihistamines before discovering the issue was entirely drug-induced. Once her medication was carefully changed to an alternative compound that avoids the specific inflammatory pathway, the persistent tickle in her throat completely disappeared within 2 short weeks. However, everyone must understand that a separate, rare symptom within this identical pharmaceutical family constitutes an absolute medical emergency that demands immediate professional intervention. If you experience sudden swelling of your lips, tongue, face, or throat that compromises your ability to breathe or swallow, you must call emergency medical services immediately without waiting for morning. This dangerous condition is medically identified as angioedema, and it possesses the capacity to obstruct your vital upper airway significantly faster than most ordinary individuals would ever anticipate. Losartan represents an angiotensin receptor blocker that functions on a comparable physiological pathway to relax your vascular network, but achieves this goal through a slightly different mechanism. One notable biochemical consequence of utilizing this specific category of medication is that it can gradually cause an accumulation of vital potassium ions within your human bloodstream over time. While potassium levels usually remain within a standard safe range under routine medical monitoring, common lifestyle decisions can inadvertently elevate this electrolyte to highly hazardous thresholds. Many health-conscious individuals attempting to reduce their sodium intake purchase popular salt substitutes at the local grocery store without reading the detailed nutritional labels on the container. These common low-sodium alternatives frequently replace standard sodium molecules with substantial amounts of potassium chloride, which introduces a massive, unexpected load of this specific electrolyte. An older adult who uses these substitutes generously on every home meal is actively pouring excessive potassium into an internal system that is already retaining the mineral due to their medication. This dangerous combination can rapidly drive blood potassium concentrations to extreme levels that directly interfere with the delicate intrinsic electrical activity of your beating human heart. Abnormally high potassium levels do not always announce themselves with obvious symptoms, but can manifest quietly as unusual muscle weakness, persistent daily fatigue, or intense cramping in your legs. Some individuals may notice a subtle tingling sensation in their hands or an irregular fluttering heartbeat, while others experience absolutely no clear warning signals before a major cardiac event occurs. Commercial electrolyte powders, standard meal replacement shakes, and over-the-counter exercise recovery drinks also contain significant amounts of hidden potassium that seniors rarely think to mention. A critical scenario that receives far too little attention in contemporary medical discussions is how these specific blood pressure medications behave when an older individual becomes acutely ill. When a senior experiences a standard stomach illness involving several days of persistent vomiting or severe diarrhea, the body loses vital fluids and enters a state of significant dehydration. Under these depleted conditions, the exact same dose of losartan or lisinopril that was perfectly calibrated for a healthy, well-hydrated body can begin to behave in highly unpredictable and harmful ways. Your blood pressure can suddenly plunge far too low, causing severe dizziness, while your kidneys, which are already straining from profound systemic fluid loss, become highly vulnerable to acute stress. The underlying pharmaceutical compound did not alter its properties, but your internal biological environment changed completely, forcing the drug to operate under dangerous, unintended parameters. Every individual utilizing these medications needs a proactive sick day protocol established with their physician, outlining exactly when to hold a dose and when to seek urgent clinical evaluation. Failing to discuss this specific contingency plan with your prescribing doctor leaves a substantial gap in your personal safety net that could easily lead to an avoidable emergency room visit. Imagine a typical scenario where an older adult experiencing stiff, aching joints or lower back pain reaches for a standard over-the-counter anti-inflammatory medication like ordinary ibuprofen. Because these common pain relievers can be purchased easily at any local drugstore without a prescription, people naturally assume they are completely harmless and entirely compatible with other drugs. When you regularly combine an anti-inflammatory drug with an inhibitor like lisinopril or an antagonist like losartan, you create a chemical interaction that severely reduces blood flow to kidneys. If even a mild degree of systemic dehydration is present during this combined drug usage, the risk of sustaining a serious acute kidney injury escalates to a highly dangerous level for the senior. Your vital excretory organs do not differentiate between an expensive prescription capsule and an inexpensive over-the-counter tablet because they respond exclusively to basic physiological chemistry. Seniors who require regular relief from chronic arthritis or structural back pain should actively explore alternative therapeutic pathways that do not compromise their long-term renal function. Utilizing acetaminophen, applying targeted topical treatments, or engaging in structured physical therapy represent far safer approaches that successfully manage discomfort without endangering the kidneys. We must thoroughly evaluate a symptom that frequently sounds minor to most patients but carries immense statistical danger, namely, a brief sensation of unsteadiness when standing up from a sofa. The surrounding room appears to tilt slightly for a single brief moment, causing the individual to grab a nearby door frame for support before the feeling passes and they resume their normal activity. Among mature individuals managing their hypertension, this lightheaded experience occurs with high frequency, yet it remains one of the most universally underreported symptoms in modern clinical practice. Within an older population, a few fleeting seconds of profound dizziness is fully sufficient to precipitate a sudden fall, which can easily result in a severe skeletal fracture of the hip or spine. A serious orthopedic injury of this nature can permanently alter an older individual's long-term health trajectory in profoundly negative ways that require multiple years of grueling rehabilitation. This critical warning is not an exaggeration, but represents basic physics and human biology working together in a specific manner that demands absolute respect from patients and caregivers alike. The temporary lightheadedness occurs because your prescribed therapy is actively lowering your systemic pressure, and your cardiovascular network requires an extra moment to adjust to positional shifts. When you stand up too rapidly from a seated position, your systemic blood pressure drops momentarily, which briefly diminishes the vital supply of oxygenated blood moving upward toward your brain tissue. The most practical solution is to consciously slow down your movements by sitting on the edge of your bed for several moments before attempting to stand upright and holding on to a stable surface. However, any dizziness that occurs consistently over an extended period or any distinct episode of near fainting requires an immediate comprehensive medical evaluation and a potential dose revision. To minimize unnecessary personal anxiety, we must address the widespread misconception that human blood pressure is a fixed, immutable number that should remain identical during every single measurement. In reality, your systemic arterial pressure fluctuates constantly throughout every hour of the day in direct response to a vast multitude of everyday environmental and psychological variables. Your current numbers are heavily influenced by how well you slept the previous night, whether you consumed caffeine recently, and whether you are experiencing physical discomfort or emotional anxiety. Even the simple act of walking quickly into the clinic room, speaking loudly right before a reading, or worrying about the result itself can artificially elevate your numbers by several points. A single high reading obtained on a random stressful morning does not indicate that your long-term medical therapy is failing completely or that your current dosage is suddenly insufficient. Conversely, an isolated low measurement recorded after spending a hot, dehydrating afternoon outdoors does not automatically mean that your prescribed dose has suddenly become far too powerful for you. The only metric that truly matters in clinical practice is the overarching long-term pattern established by measuring your pressure consistently using a highly deliberate and structured method. You should ideally collect your data using the exact same arm at the identical time each day after enjoying at least 5 full minutes of quiet, undisturbed rest without rushing or talking. When individuals monitor their numbers inconsistently and react to isolated high readings with intense emotional panic, the decisions that follow are almost never medically sound or beneficial. Terrified patients frequently ingest unauthorized extra doses out of acute fear, or skip critical scheduled doses simply because a single random measurement appeared normal on their home device. Maintaining a detailed written log over several weeks and bringing that organized record to your clinical appointments allows real patterns to guide your treatment rather than ungrounded panic. This single shift in your daily routine dramatically reduces psychological anxiety, improves medical decision-making, and provides your physician with highly superior diagnostic information. These specialized pharmaceutical agents work exclusively through a steady, continuous presence in your bloodstream rather than through erratic spikes, gaps, or reactive adjustments made in fear. Amlodipine, losartan, and lisinopril are explicitly not designed to be used as rescue medications that you reach for reactively, the way you would casually take an aspirin after a headache begins. Their primary therapeutic design is to establish and maintain a highly stable chemical environment within your entire cardiovascular system, which requires absolute compliance with scheduling. When this necessary consistency is disrupted by missed tablets, unauthorized double doses, or highly erratic timing, your blood pressure will inevitably fluctuate in highly volatile and dangerous ways. If you occasionally forget a dose, the standard medical recommendation is to ingest the tablet as soon as you remember, unless you are already very close to your next scheduled application time. In that specific situation, you should simply skip the missed tablet entirely and resume your regular, established schedule rather than attempting to double your dose to compensate for the error. Instead of relying on generalized internet guidance, you should explicitly request precise written instructions from your personal prescribing physician regarding how to handle a missed pill. Write these custom instructions down clearly or store them securely within your mobile telephone so you are never left guessing during a moment of sudden realization and confusion. The absolute best hypertension medication is never simply the one that generates the most visually impressive numbers on a clinical chart during your brief periodic doctor appointments. The ideal therapy is the specific compound that you can consume safely, consistently, and comfortably within the complete practical reality of your daily habits, lifestyle, and existing health. A prescription that appears mathematically perfect on paper but keeps you awake all night coughing or swells your ankles until you stop walking is fundamentally not a successful treatment. Adverse physical symptoms are not a personal character flaw, nor do they indicate that you are being overly sensitive to a standard drug that other individuals tolerate without issue. These symptoms represent direct, essential communication from your physical body, utilizing the only expressive language it possesses to signal that an internal imbalance requires attention. Far too many mature individuals endure significant discomfort in total silence because they falsely assume that suffering is a mandatory requirement of managing their cardiovascular health. This dangerous assumption is completely devoid of sound medical basis because contemporary clinical practice offers an abundance of alternative strategies, adjustments, and combinations. These excellent therapeutic options only become accessible to you when you actively find your voice and communicate your daily physical experiences clearly to your healthcare team. Remaining completely silent while enduring a distressing side effect is not a sign of clinical compliance, but is a dangerous setup that frequently leads to sudden, uncoordinated non-compliance. The day you quietly decide to stop taking your medication entirely without professional oversight is the exact moment your systemic pressure climbs back up, exposing you to severe harm. Let us firmly establish the core framework for your safety by remembering that taking amlodipine requires diligent monitoring for lower limb swelling, especially during the late afternoon hours. If your current daily regimen includes lisinopril, you must remain highly vigilant for a dry, lingering cough and understand that facial or throat swelling represents a critical emergency. Those utilizing losartan must actively watch for subtle indicators of elevated potassium levels, such as unusual muscle weakness, while avoiding potassium-heavy salt substitutes entirely. Regardless of your specific prescription, always rise slowly from a seated position to prevent catastrophic falls, and never combine your therapy with over-the-counter anti-inflammatories. By dedicating your valuable time to educating yourself today, you have demonstrated a profound commitment to your personal longevity and an admirable respect for your physical well-being. Acquiring genuine medical clarity is the precise mechanism that transforms a simple printed script in your hand into a powerful, highly successful lifestyle plan that protects your future.